Welcome back, everyone, to the Voice of Rural Health, the Maryland Rural Health Association's podcast. We're excited to be back with another fantastic episode. Today, we have the affiliated Santé Group on and CEO Michelle Grigsby Hackett. Michelle, would you like to introduce yourself?
Yes. Hi, everyone. I am Michelle Grigsby Hackett. I'm the CEO of affiliated Santé Group, as Jonathan indicated. I have a background in mental health. I've been providing services and working in the mental health industry for over 25 years. I'm a licensed clinician, as well as, again, the CEO of our nonprofit organization, affiliated Santé Group. Glad to be here today.
We're excited to have you on. And for those who don't know what the affiliated Santé Group is and what you do, could you give them a quick overview?
Absolutely. So we're a nonprofit behavioral health outpatient and crisis response provider. So with that, we have a wide array of mental health services, ranging from outpatient mental health clinics, psychiatric rehab programs, peer recovery centers, and peer wellness centers. We also are the largest crisis response provider in Maryland, serving 16 jurisdictions. With that, we have a wide array of services there as well. So we have local hotlines and warm lines. We also serve as part of the 988 network, answering calls throughout Maryland for 988, and mobile crisis services and training for individuals who want to learn about de-escalation and learn more about mental health conditions. We train law enforcement and other first responders, as well as community providers. And we've been around for over 30 years.
That's fantastic. And obviously, there's a huge need for mental health services, not only in urban areas, but in rural communities as well.
Yes.
And you talked about, crisis response. And, I think that the audience may or may not know that my background in healthcare, outside of healthcare, is emergency services. And there's huge needs to bridge some of that mental health divide between healthcare entities and first responders, both in law enforcement, fire, and EMS, which so I'm
Yes.
glad to hear that training is available. Could you maybe talk a little bit more about your background? You mentioned that you've been in this industry for 25 years and some of your leadership experience and some of the trends maybe you've seen over those 25 years.
Oh my gosh, a lot of trends. One of the things that I think I'll say, what I've seen, especially since the pandemic, is a great increase in awareness of mental health and reducing some of the long-term stigma that had been in place regarding whether it's seeking mental health care, even talking about your mental health. So I think one of the ways where the systems have evolved is that it's okay to talk about it. It's okay to reach out. Being able to have an easy number like 988 to call, where you can talk to somebody when you're having a hard time. I think that's something that when I was early on in my career, it was really tough. It was really tough to get people to say, no, I want to go seek help, or I want to be able to have a wellness component in my life that involves my mental health, not just my physical health. So I've seen that trend change in the course of my career. One of the things that I've seen that has been a challenge is this workforce shortage. Back when I started, there were a lot of students that were interested in and going to school to become mental health professionals. Now we're struggling with individuals who want to get into the field. But when they do want to get into the field, most of them are going into private practice. So working for outpatient organizations or nonprofit organizations, we don't see that as frequently. And that's a big challenge, especially compared to the need that is growing for people who need to seek help and have professionals be able to support them.
Absolutely. I think you hit the nail on the head there that the need is great, and obviously in rural areas as well, but that workforce shortage is significant. I mean, there are barriers across the board and filling gaps, not only with providers, mental health providers and primary care and specialty providers, but also nurses and some of that support staff. There are, again, significant gaps in rural communities. I think that, a lot of individuals graduate and they go work for those for-profit entities, or they move out of the state of Maryland, or they don't want to work in rural communities. And so this presents a significant kind of that cyclical cycle of rotation and turnover, but then gaps, which obviously we need providers to provide the necessary services, right? Your organization
Hmm.
is providing. And so it's an ever evolving challenge with that workforce. And maybe you can address some of that. So, what are Sante's plans and new programs for 25? And are things that are out there that you're looking forward to? And are there ways that you're going to try to address that workforce challenge?
Oh, absolutely. In terms of 2025, we've had some great opportunities. One being we've been able to expand peer wellness and recovery support services. So, being able to have additional centers where individuals who have lived experience can come together and be able to be a support network. So, we're looking forward to bringing that online. In one of our rural areas, Cecil County, we were awarded congressionally directed spending funds to be able to implement a co-responder team there, so a clinician and an officer, to be able to, like you spoke to earlier, bridge the gap between public safety and mental health and have that tailored response for individuals who have, the concurring public safety concerns and mental health issues that they're dealing with. We're also looking into ways to address the workforce shortage, being able to partner with universities to potentially pull together certification programs, other educational and workforce initiatives that we can help to draw more individuals to the field, especially to the work of crisis, because that's not something that many individuals who go into a counseling program at a university or college will get exposure to. So bringing more exposure to those areas of work, and continuing with advocacy. Advocacy this year has been huge for us, both on the state and federal level, being able to address things like the budget deficit and making sure that funding for mental health and crisis services are protected, but not just protected, being able to be expanded upon as we look to see how that need is going to continue to rise. So that's just some of the things on our horizon. And also, we are consultants for others in the mental health field. So for organizations or individuals interested in getting into crisis work or mental health work, we are able to consult with those individuals as well.
Well, thank you, because that was, not only some work that you're doing that I'm not aware of. If I'm not aware of that, that means that a lot of our rural partners probably aren't aware of the work that you're doing either.
Mhm.
That's good to hear. It's also good to hear that you got some congressionally directed spending to do some work up north. That's fantastic, and obviously, the advocacy piece is huge. The Maryland General Assembly and the work that we're doing in Annapolis and the work that we're doing in Capitol
Yes,
Hill is never ending, right? And so
yes,
finding ways to address, budget shortfalls and advocating and putting a voice to our members in those rural communities that, desperately need services. Obviously, I've said for a long time that there, are definitely needs in urban pockets, but the needs of the rural
yeah,
also are significant, and they're different, right, than what you would see in Baltimore County or Prince George's County. Mental health services are a need, but how do you approach that, right? And so
exactly.
in rural communities, more community based, getting in and getting services to the people and to the patients. And then also telehealth has been a huge
Yes,
asset to us in rural communities, especially with primary care and also mental health services, getting folks in front of cameras and with other mental health providers, because there's just not enough mental health providers in rural
that's right.
communities. We have like one or two psychiatrists in the area in Western Maryland, and again, that's not enough
No,
for the need
yeah.
that is there, right? And so, and that's exciting news. And you kind of mentioned, some of your plans and programs for 25, but looking long term, obviously there are some challenges ahead with
Yeah,
some budgets, both at a state and federal level, and even at a local level. You know,
yeah.
mental health services and crisis response. How do you plan to kind of move that needle forward for state and federal legislators and beyond just this particular year?
It starts with being able to educate the legislators about the work that's being done, being able to invite them out to our location so that they can see the work in action. You know, that this concept of crisis response can seem so nebulous to folks that it's hard to really wrap your mind around what does that really mean? What does that, you know, what is that impact? What are my dollars paying for? So being able to educate around what the services are, what the savings are, as it relates to if someone is being served in the community to address their crisis, they're not going to higher cost situations like a hospital or environments like a hospital, or being connected to the criminal justice system. So the diversion aspects of crisis services are something that people often don't connect with or don't really understand. So that's a lot of the work that we do, to be able to help legislators understand what their dollars are paying for. Situations such as the youth services that we provide, being able to again show the data and the information on how that is helping communities thrive and helping to address things like hospital overstays. Maryland has the highest rate of hospital wait times. So if we can reallocate or allocate resources to help divert that need and serve individuals in the communities that they live in, it's far much more successful and has greater long-term impacts. So those are areas. When we're looking at facing the potential federal cuts to Medicaid, that is potentially devastating for Marylanders because it could equate to $1 billion cut in Medicaid services to Marylanders. That's going to be significant to the expansions that have been created and access that's been created for people to be able to get their needs, their medical and their mental health needs addressed. So making sure that we're putting that word out and getting the voices of those individuals out so people understand what's at risk. And to be creative and innovative of, if the money's not there, how do we still meet the needs of our communities? And that's a tough challenge.
You're absolutely right. You know, as an organization, you know, we often have those tough budget discussions of, you know, how do we continue to, you know, function as an association? And obviously
Mhm.
that is challenging just for, you know, mental health service providers like yourself. You know, how do you continue to function with, you know, cuts looming on budgets from not only a pass down from the federal government down to the states, but then down to your organizations. That's
Yep.
very challenging because obviously the need's not going away, right? So there's always
Right.
going to be a need for services, and how do you continue to provide them? I think that advocacy is huge, and I think that starts. You're right with education. You know, we've been very proactive at the association trying to enhance education for legislators because oftentimes, you know, they don't see the root of the problem, but they also don't see how you're addressing that problem from your
Yep.
services and from your direct care services. And so it's good to hear that you're, you know, bringing them in and showing them exactly the boots on the ground work that you're doing, to show them where the dollars actually go to and how that affects
Mhm.
their communities across the board, because all of Maryland is in dire need of assistance for mental health services, not just rural, but you know,
Yeah.
it's good to see that education happening. And you know, this is fantastic, and this has been a great conversation. You know, we've touched on a lot, right? Workforce and budgets
Yes.
and the challenges that lay ahead with workforce, and this has been fantastic. You know, are there any other things that you'd like to add about the work that you're doing, or how people can get involved? Would you like to end on that?
Yes, definitely. I think, you know, it's an all hands on deck. We all need folks involved in whether it's advocacy, whether it's talking to their loved ones or their friends, and just saying things like, you know, if you need help or if you need someone to talk to, call 988. That number is there. It's available. There are counselors on the other end ready to receive the call. Being able to reach out to the community, and say if you want to volunteer, being able to volunteer with various organizations, so that also lends a hand to shortages. Individuals that volunteer may not be, you know, the therapists that are providing the services, but they can also be able to provide just other assistance to nonprofit organizations to help fill that gap. Also, being able to have folks reach out to Sante. Go visit our website, www.thesantegroup.org. Please reach out to us if there's anything that you want to either help us with or you have questions about. We're here to be able to answer questions and to let you know what we struggle with or what we're doing to move the needle, whether it's through services or advocacy. Connect with us for sure.
And I love that, and I love your approach to kind of that holistic approach, right? It takes everyone, it takes a team in order to succeed and make our communities healthier and address those behavioral health needs that our rural individuals and urban individuals are experiencing. So we'll make sure to link your contact information and your website in the description of the podcast, and when we send it out, obviously all your contact information. But I want to thank you for being on and really highlighting your organization and the work that you're doing. And obviously, thank you for your support to our organization. We greatly appreciate that. And obviously, we want more people to know about the work that our members are doing, including Santé Group, because there are definitely synergies that are to be made. And again, if we can all work together collectively, we can have a healthier Maryland. So thank you so much for being on.
Thank you. Thank you for having me.